Thank you, Antonina. I would like to welcome NOYEMIN GRADINAR from Protez Foundation to join us for a prosthetics development in Ukraine talk. Welcome.
Well, I'll do a little introduction. First of all, hello everyone. My name is Naomi, and I'm here on the behalf of Protez Foundation. I finished prosthetics and orthotics at Century College, and I have the privilege of being part of Protez Foundation, and also the daughter of GRADINAR, who unfortunately could not make it to this event due to a difficult case that is being fit. I'll first start off with a short video sharing what we are, who we are as an organization.
Every day they defend our land, our home. Their eyes see what we were never meant to see. Their determination is our protection, our chance to live, breathe, and plan for tomorrow. They pay the highest price for our freedom. And when the battle is over, another fight begins. The return to civilian life. Integration is a journey, not a sprint, but a long-distance path. Every step in this new life is a step toward recovery. It's a return to family, to a child's laughter, to the warm embrace of loved ones. It's a return to oneself. Our duty is to make this journey easier, to give strength to those who once protected us.
The story of Protez Foundation began right here in the United States of America, in Minnesota. Our mission is to provide high-tech prosthetics to Ukrainian defenders, civilians, and children affected by the war. We warmly welcome our patients arriving in the USA to give them not only new prostheses, but also a new start in life. The Prosthetics Center in Minnesota became the first safe haven for assistance. Since the start of the full-scale invasion in 2022, Ukrainian military personnel and civilians who lost limbs have received a chance for a new life here. The best specialists work here, creating individualized solutions for each patient. The use of advanced bionic and functional systems allows for the maximum restoration of lost capabilities. But our goal is broader, to ensure the quality of prosthetics not only abroad, but also in Ukraine. That is why we opened a center in Svaliava, so that Ukrainian veterans could receive care at home, close to their families. Patients receive a full cycle of care: primary and secondary prosthetics, after-sales service, physical therapy, and support from specialists. In the heart of the capital, at the Kyiv Prosthetic Center, we provide a continuous cycle of support and a full range of services. Prosthetics manufacturing, their adjustment, adaptation, and subsequent maintenance. We combine experience, technology, and hearts to make prosthetics in Ukraine accessible and modern. Protez Foundation is also a space for veterans. We help not only to restore the function of the limb, but also to restore themselves into sports, into a profession, into life. Our emotional and social reintegration projects help veterans feel they are not alone. In the USA, we created Protez Academy, an educational program for Ukrainian specialists. It transfers advanced knowledge in the field of prosthetics and rehabilitation, systematizes experience that was previously lacking in Ukraine. More than 100 Ukrainian specialists have already completed the training. We created the Amputee Rehab Summit platform, which brings together Ukrainian and international specialists in the field of rehabilitation and prosthetics. We train Ukrainian doctors of physical and rehabilitation medicine, physical therapists, occupational therapists, orthopedists, surgeons, and prosthetists. The last summit gathered 800 participants offline and 1,000 online. Our investment is knowledge that will remain in Ukraine for years. Protez Foundation. Over 2,000 prostheses installed and opportunities restored. Together for recovery.
So our foundation, Protez, was founded in 2022 by prosthetist and orthotist Yakov GRADINAR and our CEO, Yuri Arashidze. And in Minnesota, we opened up a clinic with one goal, and it was to help Ukraine in any way that we could. So with increased numbers of prosthetics that needed to be given in Ukraine, we took that action and we wanted to help in any way we can. In order not to only give prosthetics, modern prosthetics, for amputations of any type of any complex amputations, but also moral and psychological support to patients during the rehab, and training and education to specialists in prosthetics and rehab and to strengthen the Ukrainian system. Our nonprofit is not only just us as workers, it was as a family. So together with many people coming together, more than 100 people with the same mission of helping Ukraine. So from ceremonial welcomes, as you saw in the video, to accommodating their stay and to spreading the word of prosthetics, the rehab, and so on. Protez Foundation, we, in the span of, since war started, we were able to fit over 1,005 patients and give out 2,052 patients, prosthetics to those patients. And why such a big number is because it's not only 1 to 2 amputations, it's 3-4 amputations levels from above knee to arms, and there's multiple of them. So, and during that time, we've opened up 3 clinics. One is in Minnesota, in Oakdale, and one is in Svalava, in Ukraine, Kyiv, the heart of Kyiv. And in the following year, we are opening up one for Ministry of Internal Affairs. With their help, we were able to continue to grow the prosthetics in Ukraine, expand the knowledge to different specialists, and bring prosthetics and bring patients the ability to renew their life again, to start living, and to be able to continue their stay and the work that they're doing. So with Protez Academy, we were able to teach specialists. And from there, we opened up, this is our team in Ukraine, and we as a multidisciplinary team, from PTs, OTs, to other specialists, we're able to bring them together for them to learn and train. And as a big team, we are able to spread the word and bring the help to Ukraine. With not only Protez Academy, but with the Amputee Rehab Summit, the third one that we've had so far, we are able to, here's a little bit about the Protez Academy. We're able to bring knowledge to the international level, from prosthetics care to physical therapy, rehab, and other medical disciplines that are needed in order to bring the level of healthcare up in Ukraine. And the goal of the summit was to bring a systematic approach to all people in the industry in order to bring patients, veterans, back into their active life. So we not only fit soldiers and civilians that have lost their limbs, but also children. And seeing that opportunity to expand not only in the area of veterans and civilians, but also children that need the help. With work continuing and hundreds of patients in need of care and causes of the amputations varying from tourniquet syndromes to explosions, and the tourniquet syndromes that cause not only maybe below knee, above knee amputations, but bilateral above knee, where they're very short and it's very hard to give them prosthetics. And more than 1,000 patients are currently waiting that are on the waiting list for us in order to receive care. And that's only in our clinic. There's many more, as said previously, many more prosthetics clinics that have many patients that need the help. So in the past week, I have just recently arrived from Ukraine after spending 5.5 months teaching, helping our clinic there, and doing upper extremity for the patients there. I saw that, like, no matter where we are working together in order to bring the level of healthcare to make it better and to improve all the systems. I would like to share a video. Oh, time. Well, I'll share a little bit about the patient with such difficult cases. Alexander, he went through over 130 surgeries, 6 septic shocks, and he was told that he will not be able to live. But we took that opportunity, and many people, I apologize, I'm translating in my head, they took that calling and reached out, and together we were able to bring him up to stand on his feet, and now he's reunited with his daughter in Ukraine, and he's able to walk, with doctors telling him that he will not be able to sit or do anything. Now he's walking, working, and greeting his daughter from school. So thank you.